And I'm a consultant in radiology, that is diagnostic medicine. And I work at Alex Ekweme Federal University Teaching Hospital, Abakaliki, which is my main place of work. I also consult part-time at National Obstetric Fistula Center, or the hospital which is very close to specialists that we used to call VVF Center in the past. And then on Tuesdays and Fridays, I consult at Capital Medicare, Abakaliki, Waterworks Road. I'm taking time to tell you the places I work so that if you need any assistance, you can always call on me, because there's not much we can do for our people. This little we can afford to do, we cannot hesitate to assist. So my number is available to everybody. And of course, our people have always come to all these places, and it's always a great pleasure to see them. So, mental health and its consequences, or mental health disorders and their consequences, is a timely discussion. I'm not going to take any academic approach to this discussion, because based on the fact that we cases around us. And when at least 1 or 2 persons, maybe because of the perceived degree of the mental illness. So it is just going to be a kind of community conversation. Now, from WHO perspective, mental health is not just the absence of madness, the one we call madness, which in the real sense is called schizophrenia. Mental health covers your social well-being, your psychological ability to learn what you want to learn, to take or to participate in solving societal problems, and even to fulfill your own dreams as a person. So anything, the situation of your emotions, psychology, and your ability to function for yourself and in the society encompasses your mental health. Mental health disorder, on the other hand, I'm not going to delve too deep into it. I'm going to give a general perspective, and then we consider really practical aspects. So mental health disorder includes so many things. Mental disorder. Somebody with anxiety disorder is a mental health disorder. Or if you want to be euphemistic, you don't want to provoke anybody with your use of words, it's so not a psychological disorder. Okay, it can be depression, a situation or then where even there where you lose interest even in the things you used to take the greatest pleasure in. You don't sleep well, you don't eat well, you feel like killing yourself, you lose hope, you are just weak. Even when it is daybreak, you can't get out of bed. It seems as if the world is crumbling around you. Yeah, you are not mad, but it is recognized in literature of psychiatry that this is a kind of mental health disorder. Even paranoia. Paranoia is a mental health or a psychological disability where somebody believes that everybody hates them, that everybody is talking about them, they want to kill them. Of course, people fall into this category. They're always afraid that somebody is planning against them. It's also a mental health disorder, a psychological disability. I was having a conversation with one of my friends in the UK. So he assumed that he was sharing statistics with a senior colleague in the UK because, like in the US, let me use the US, the most recent statistics. That's 1 in every 5 adults has a mental health problem. In other words, could be a water from Ofibanye, so naira na agba, ate photomadi, se naira na agba, mosro na agbo, onyena, at least. But that is not what it means. Why it seems as if they are exaggerating from our own perspective is that now some of the behaviors we exhibit here, and the normal way somebody could say water as a form of mental disorder. A situation where somebody so it is shocking to people who live in very good society. If just a little thing you start shouting, you become restless. Somebody may overtake or hold the entire generation. If you might not understand that this is a problem, but over there is classified as poor mental health. You have a mental health issue. So if you have to make the proper diagnosis, you discover that many of us actually have this problem that affects our psychology, our emotion, our ability to even face the daily task. Now, what are the risk factors? People to have this kind of situation that you can describe as a mental health disorder. It can be economic. There's poverty everywhere in Nigeria. Even, I can tell you from my own perspective, the exchange rate panics me. Anytime I look at it, I because, man, it stresses me. So it's also a source of, mental stress. I'm not going to be using the word stress so much because Prof is going to talk about that, and he's a professor of psychiatry. So poverty, people are struggling. There's no job. You wake up in the morning, you're not sure what you're going to eat. In fact, yesterday I came out of a gate. He was greatly troubled. No, 300 naira. Roughly 30 minutes. I had to give him 1,000 because if I this man came out, in the hope that he will make. There's lots of background noise. I think you may have to mute anybody who is not me at the moment. It's like a third demand, but I think it's necessary. Yeah. So economic struggle, social deprivation. People are not getting what they want. Like I'm talking to you now, I'm in darkness. You want to drive to Onicha, you are looking for the best route to take. All these things are sources of panic for us. It could be geopolitical. Like in the past 5 years, or let me say before 2021, Southeast used to be the most peaceful part of Nigeria, but now we have terrorism at home. Tomorrow is Monday, nobody is going out. And if you have to drive out for something as urgent as maybe a medical emergency, you have to be afraid because you don't know what might happen on the way. Inequality, especially gender-based inequality, which is very, very common in our own setting. Men mistreating their wives, wives mistreating their husbands, and others. So these are sources of mental health disorder. And then genetics. Genetics predisposing with some family in Bogobia, as and you have about maybe 4 members of the same family who have mental issues. The question is it just coincidence? But this kind of scenario is the one that we often attribute to maybe spiritual sources. We say somebody must have known where you hear something and all that. But I also want you to entertain even more favorably, a genetic source of mental illness that runs in families. As a matter of fact, from a biochemical perspective, the schizophrenia, that is, it has been discovered that there is a problem in the biochemistry of their brain affecting the way a neurotransmitter called dopamine flows in their brain. Even then, when they have a brain tumor, it can cause a kind of madness. So I just want you to know that there are different sources and that many of us are affected, even though we don't see it that way. But if we have that insight and perspective, we are better informed to remedy some situations and even take care of ourselves in the way we have never done before now. Now, what are the consequences of untreated problems? We lose people on a yearly basis, if not monthly basis. In our own climb, you have, if I Google me go now, you remember 1 or 2 young persons without any treatment. Why? Because we have this erroneous belief that no one here. But the question I always ask our people, what if the orthodox medicine can cure him? Are you willing? It's a very important question. It's a very good perspective to adopt when it comes to talking about our people who are afflicted with mental diseases. I'm going to tell you this short story. About 2005 or 4, when I was still in the junior years in the medical school, there was this young man whom I very well. He was doing very well financially, but it happened that papa young badata a kind of a mental illness. And even schizophrenia is that even the realities you have always had, the beliefs you have always had, the way you have always seen life, you will see it is not going to be erased from your consciousness. You will still be saying things relating to all the repertoire, the entire body of knowledge or belief system that you have always had in you. So the man started saying, and if I want to have, but you see blah, 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 blah. So when he told me, he said, whatever it is, whatever it will cost, let us take this man to psychiatric hospital. So we bundled him into the vehicle, had a psychiatric hospital Enugu. The following day, Dr. Najue, nde ife na mma ife na oti na feel na ife bia. Yes, no bu ya bia nke grema ya do ha ye ife na enya. The man was now sober and crying. Insight. Insight is that shame that somebody who has a mental health disorder begins to feel when they are recovering. That is a good sign. So he did very well, quite terrifically, and was discharged. He still lived many more years. The following day, he has emotionally and socially killed his son in the society. But we were able to get him out of it. How did he survive? So these are some of the myths, the legends we have to start revising among our people. It is not so fortunate that the audience here, an elite crop. But the idea is that if you imbibe this knowledge, you can spread it. All right? So let us not abandon any young person. Young man, maybe from Abuja or Lagos, as no somebody in his prime, 30-something, 40-something, it is not good. So if we do not tackle these problems from an orthodox perspective, if we insist on adopting the spiritistic view of everything, we are more likely to be laissez-faire. We are more likely to ignore our responsibilities. So we should understand that yes, directly, but the psychological stress that and believe me, by the time you give them the necessary injection and place them on the necessary medications, they are going to do well and function very well in the society. It might be something that will be ongoing for a relatively long time. In that case, it has to be that psychological conditioning, the counseling, that this is the real truth about your situation today. Man, you have to keep taking this medication so that you can be like others, so that we stop losing our people. Now, the role of community conversation, which is what we are doing today, is to sensitize us, to educate us, to influence our belief system that, yeah, somebody can be crazy, in quote, and something can still be done about the person and they're able to function again in the society. And one of the reasons we fail to tackle the issues of mental health disorder in our society was stigma. Ndị agaghị ezi asụ n'era na-agba ya, ndị agaghị ezi asụ n'era na-agba nwata ya, ndị agaghị ezi asụ n'onye omera na-agba abụọ kpana ya ma ọ nwụneta ya. By not accepting the reality, we act late. But if we are able to understand that nera na magba everybody to different degrees, the stigma is partly, if not completely, removed. So we should adopt this approach of early identification and treatment. We should also make our people to realize that we can always do something. And abandon. The person can still relapse into that kind of situation again. Now, at this point, there are 20 of us. Okay, one person has just left. If you have not joined my Facebook platform called Roadside Medical Education, where I take my time to explain everything about medicine, the way please you should search it out and be part of it. I actually think it's a privilege for me that Nenyem this opportunity to do for my people what I've always done for strangers, free of charge. We started around 7:12 and this is 7:34. It means that I've spoken for 22 minutes. So I think I'm going to stop at this moment. If the other speakers are not yet here, others we are free to ask questions and we can discuss around them. Thank you very much.
Thank you, sir. Well done, sir. I like Jacobia come, Ebio come, and I'm Mutagio Onicha, Onicha, Mama Gengime, Na, a Chokonji Kuzriman or Green.
No,
thank you.
Oga Dan, Dico, and when resource person was on around, so Sani Jujiajo, maybe few questions.
Dr. Ben is here, but we can still take questions.
Okay. Dico, Yaboni, where you mute Joy so that we can go to Dr. Ben.
Thank you. Dr. Dave.
Go ahead,
Hello?
sir. Go ahead, sir.
Okay. I am very much happy if you could I am water from this lecture. So eventually mental disorder and spiritual problem, are they the same thing? If they are not the same, what are the differences?
Okay,
spiritual problem
Yes.
and all that. What is spiritual problem compared to mental disorder?
Is a very germane question. Sometimes on get religion and science as if they are running on two parallel lines, but it's not always true. Now, what you decide to call a problem might just depend on your level of understanding of the causes and treatment. For instance, if it has a name in psychiatry. We call it bipolar disorder. Bipolar disorder, a situation somebody today, the person will be filled with energy. Or say, now. After 2 weeks, it may abandon that one. The person will start feeling like a piece of rubbish. So it has a manic phase. And then before you know it, the person is feeling useless and completely weak and lose orientation. And for the fact that now it means that we are indirectly saying that this is a spiritual problem, right? But from the scientific perspective, we call it bipolar disorder. And there are known medications, focus on our function well in the society. Dadan knows me very well on social media. He knows the stance I take on some of these matters. I do not completely disagree with the notion that there were spiritual dimensions to things. But if you do not make people to understand the ones that are not true, they are given completely over to the whole thing. In time. So I want to say let spiritual problems exist, but let us learn to tackle them with orthodox medicine also. Yeah, so that's my take. For most of us, I personally don't elevate or enthrone the spiritual dimensions of our problems, because now most of the things I know here. Empirically, you can pin it down to something. Ma asuna ma de emezi asuna nwa nkeke bụ na ọkọbịa mebe agbagabo na ọma na ha tiere enya nene nte na yi na okporo medokwu n'isi. But the fact may just be that nwa nkeke anọdụ gbakọ ego n'onwe before ya bịa tie ka n'ụlọ. So ya ria ma capital ya mgbe ọ nọ n'azụ town imeji business. Nke ọwọkụ ife agaghara nwa nkeke ya bịazi abụrụ a psychological stress for nwa nkeke. And then nobody did this thing to nwa nkeke. You understand me? So yeah, I'm not saying this. Most of the things we call spiritual problems are not spiritual problems. If we can tell ourselves the truth and sit down and think deeply about the causes. Thank you.
Thank you very much.
Lord D, diko ya kwara na makpozi ya kwa oyo bu wonire aka diko
kpọziri ma nwunye m.
Nna chọkwa ka eti ewu n'eke nke ma na ka.
No Gmail name cha. Okay, diko n'ife ezefa mbụ Lawrence Okereke. Mbụ onye unwu bụ. So by the grace of God, nna akuzi na UNN here. Na Enugu campus.
Oh, that's wonderful.
Yeah, I'm very, very happy to hear Doc Nongwe knock on UNN here. I'm happy to. Okay. Ajum Budiko enwe ifru Doc gbasara early dictation of onye nwere schizophrenia. So and adequate orthodox medicine at the early stage na-enwere ike ịkweta. My question bụ again na nwanne nya na-ekwa Chifani Nwankwo. I was surprised to see two young guys very well back in the days in Port Harcourt. They were roaming in the street naked and just like that. So I was shocked. So brother, find me something. I lost word to say something. So now, so in such kind of situation, when you know trouble, I don't know. If you nwere ike ime na onye nnọtawere here, so me ife nwere ike inwe isi. That's my question.
Okay, thank you. Thank you very much. There was something very important I skipped. You know, the issue of drug abuse, because is behind most of the cases of schizophrenia among young people at home, ranging from alcohol abuse to Indian hemp to kolos to mkpụrụ, which is forgotten. It's one of the medications well known in medicine. People just discovered that you could get them high and they started abusing it. So in their case, it might have been what triggered the whole thing, right? Now, if you are able to identify the source of this mental disorder, the first thing you have to do is to remove it. Onye ọbụm bịafụtara ọbịa so brother kenara ya ife, maybe mgbe nyere 500 naira, ọgbakwa ma nrọkọrọbe jeje zụta Indian hemp ya, ma ọ zụta mkpụrụ mmiri ya, ma kolos. You know, these people, they are very resourceful. They know how to get distance even from hidden places. You understand? So, otuabi wenenke ha do prolong, not do chronic. First of all, we can start by removing the trigger, right? It's one of the resources we lack here in our own setting. Rehabilitation centers. We have psychiatric hospitals, a couple of them, but rehabilitation after the treatment, how do you get the person back, reintegrate them into the society? So okay, you will not be doing this, and then you gather them in a community of those who are equally affected. People will share their own experiences, how they came out of it. You are trying to reconfigure this person psychologically and, from a habit perspective. So in the when I case ahead or too much, if we can give them attention, take them to a psychiatric home away from the source, they are likely going to do very well. And after that, you rehabilitate them. And if possible, you equip them with skills that will help them to survive. It's a long-term process, but the resources are not there. Like Gujen and UK now, many of the doctors leaving Nigeria out of desperation to Japan, they go into psychiatry. Why? Because in the UK, the government votes the largest amount of money for NHS into psychiatry. So they make more money because they realize that there almost everybody is mad. And almost everybody is mad. There are people who are even more normal than us, in quote. You understand? So this is where policy makers can come in. I'm beginning to sound theoretical, but at least you have to know that this is what it should be, ideally. Yeah, thank you.
Okay.
Chief Igwe, go ahead, sir.
Okay.
Just hold on, please. The number we are seeing to ask this last question is Lord Z. Please, can you tell us your real name?
Okay, so if I'm Lawrence Okereke,
Okay.
God
bless you. You can bring down your hand now.
This is my question with Part B.
Okay, go ahead.
Like some of India, they come from Onyoma, on the Matra and Port Harcourt, Eba Anyin and Pakonoma, a fresh and is in a Jagarina street, So, and I know one of them too were not the only surviving child. Of which then with that onye Jesodo say do their anywhere. So on whatever like nwere ike ime na group na so ma okay eje hu onye do otu nweta nwere ike iji nyere onye do otu nweka.
Okay, thank you very much. I know that this question is for everybody. I just looked around for Professor Igwe. He's not yet here. But Noneka, he would testify that there are sometimes I call him about Ndibanye, Ndo affected. Sometimes he says, bring them to my clinic or bring them to Federal Teaching Hospital Abakaliki, where he was here with us. So, Ekwe Sikwama, rising from this conversation, there should be a plan on what to do about such people. Although error were very cheap, the only problem with it was compliance. Okay, and we're one of my extended relations affected by this thing. So I have been on his matter. I tried to prevail on him to take his medications. At least for the past 1.5 years, he has been all right. But again, there's also a different person. They will call me Ma Abiaba of Ono. In fact, no, we taking him to psychiatric hospital 2 times.
Prof, for information, Prof is on board now, please.
Okay, good. So, Anonya na ngwangro. So, make a tife, yeah, bago a kind of cycle. Say, go bango ngwangro, yes, some, oh, yeah, go breme. So, I was completely discouraged. But for the memory identify, luckily enough, Prof is here. He can help us. And Prof, I want to welcome you because I just finished talking and they're asking me some questions that are actually from your own area of specialization. I just discussed mental health on a basic level. So, but no one now name where few boys, two boys precisely. If any medicines and it's likely Nandia with a hana ngota, madam. Ike Kwadogobia say of immediately. Yabo money take you out of the environment, money remove the trigger that it will still come by. And again, we face this forum. Now that you are here, sir, we are privileged to hear from you. Thank you, Prof.
Okay. Ogadan it's not Prof on a cast, it's no on a course.
Oh no, my here, but
his
mic is still muted.
Okay.
Yeah.
Okay. Diko, after explanation by Prof, Chief Ikwagu Ifua, after Chief Ikwagu Josiah Ifua, and you get to Ben, because of our time.
Yeah.
Prof. Okay, let me see if I can locate him and unmute him.
I've unmuted. Hello.
Okay, sir. You're welcome, sir. Good evening, Prof.
Oh, I apologize, but late. I was on transit.
No problem, Prof.
I'm
welcome,
sorry.
Sir.
Ndị na-ejegharị n'unu ewadụ ụtọ na anyị dụkwa lụkị na anyị nwe maịka anyị na-eneta ha n'unu but na-eje na ije kpụta ha na-ezo kwụrụ ha bịa in medicine no mmadụ chọrọ ọbịa si treat ya ije na-edute by force ma ọ bụ na n'isi adịghị mma so ya bụ na enweta ji iji dutere anyị we can take it off from there. Ma ọkwanụ ndị ụlọ ha ma ndị onye ọbụla ndụ consent, but we need a consent before we can treat the person. And then ife na-enye nsogbu n'unu nte bụ na a na-amịzi nwa efia ma ife na-anwụ anwụ ma ife na-amị openly and then enweghị restriction. About 2 weeks ago na-ayata na-apụ udo mma ka ahịa nọ na-anwụ na-akwọpụ o nwekwa ezokwa ezo o nwedokwa otu ihe nji emego nwere onye ọ gbasara. So I was so disturbed that no ruo that level in Ibani. In that case, my advocate, we town union GGBI into it. Some nearby towns were embargo on selling of psychoactive substances. We got embargo. Ijene jidendị na anwụ marutu henji na handle but in Kiba anyị nwere onye na-akpa isi ndị mmadụ na-anwụzi so openly na-ere so openly. And then most of the psychiatric cases I now we fall out of even I mean even SS and even one. So even the food but ya bro job na-ejegari enwere eji dutere anyị we know how we can help whether there is money or no money. We are there to assist them.
Thank you, Prof.
Thank you, Prof. Chief Ikwagu, go ahead.
Anyị niile nwa ajụ na chọrọ ịjụ Dr. Dave mgbe furu maka mental health. So em na-ajụ maka nke a na-asụ ịkwa ma ọ na mmadụ hụmara ama dịka ndị na-ahụ mama maka mmanụ mgbe a nwasịrị na mma nkụkwara ama mgbe ọ bụ enwere arịbeberi mgbe ọ bụ kesa asụ m ọ na-enwe nna amị ma ọhịfịa ma anything. I was very young. So like one day in his school now, from up person, they said it. So they before you know say here flash oko umpareka and disappear this sick home. So they go to the home. So what no mad in Bobo.
Okay. It's a very hilarious one.
If you are funny.
Yeah. Okay, thank you very much. In psychiatry, we have something we call delusion. We also have what we call hallucination. A hallucination is a situation where you are perceiving something that is not really there. Whether you are hearing it, we say it's auditory hallucination. You are seeing it, we say it's visual hallucination. You are perceiving the scent of something, we say it's olfactory hallucination. So it is possible that you had an episodic visual hallucination, which, like I told you, we are all mad to different degrees, right? That did not last for you because you are a lucky and blessed man. The hallucination could explain it. Are you there? Now, from experience, you know, for many, many years, but because of the many stories that have been told about ghosts, you are expecting to see one. So as you are coming close, this model is beginning to transfigure into somebody we see. Then you see a cover. That is a neuronal reaction. that it's psychological, it is also neuronal. It's from your central nervous system. But so that could also.
Sorry, Dr. Ben, you are very okay now. Please.
But Chief, if you were temporarily mad at that moment, you are okay today. So we give God the glory. It could happen to anybody. It is not in my domain to disprove whether ghosts really exist or not, but I'm hoping to see one day, and I'm looking forward. Thank you.
Josiah, please, so that we can go to Dr. Ben.
Okay.
Can I say something about this?
Okay, go ahead, sir.
It would have been a very good experience for him to describe for us how Otumando. I have not seen one.
But why can you make the Domando?
Language, eh?
Sorry, I am like a question mad. Mad is a derogatory term. It's not in medicine. We don't say somebody is mad. We say somebody is sick. Because the same sickness I in a treaty, but the same sickness they when a treaty, Dr. Okpara. So nobody is really mad. That is not in our domain. But in the issue of somebody and then you ascribe it that no with mental illness. Mental illness, sometimes they may diagnose, I go pick it at one symptom. Especially mentally sick. There has to be a collection of symptoms that will help us to make a diagnosis. So, like, you go to your mother or your father and say, ikurum, or it's okay, especially when you're about sleeping or when you're about waking up. So those are kinds of hallucinatory experiences which are episodic, as Dave said. So they don't translate to somebody being sick. So some of these symptoms we see in those that are mentally sick are also seen in normal people. Not in when with collection of them that may impair the person's function. That is where the person is termed to be sick. So you have only a normal voice, and eventually nobody told you that there was no voice. It doesn't mean that you are sick. Or you saw something flash. Those are episodic hallucinations, which are usually when you're about waking up or when you're about. Yes, you are right. When you're about waking up, especially when you're about sleeping, it's common in those times. So I think that's the contribution I want to put in.
Thank you, Prof. Thank you. Josiah, go ahead so that we can move to Dr. Okpara.
Okay, Dave, Professor Igwe. God bless you. Enwe narị na-afụge n'ọdụkwa ha n'ọbara afụ na isi na-eme papa isi na-eme nwata nke nwa isi na-eme nwa nwe ya asụ n'ọdụkwa ha n'ọbara so ndị a ga-eji iji akwawa ụdị ọhụ.
Okay, Josiah.
With the same mental challenge.
Okay, you know, when I was discussing, I mentioned a genetic predisposition, mental illness, the biochemistry of the brain, the way the brain and the spinal, that
let me
Josiah, is your head, muted.
Okay, so yeah, anyway, genetic predisposition, because now is because the genetic material known as the DNA was passed from you to that child, and it can go even to the level of which means that even the way the brain is wired, the way the neurotransmitters, the chemicals that the brain uses to send messages from one nerve to the other, is also affected. So yeah, there is a genetic predisposition that makes it in such a way that the dopaminergic pathway, dopamine is a neurotransmitter, it's like a chemical messenger the brain uses to communicate between nerves. That in this family, because of genetic makeup, it is wired in such a way that they can easily have this sort of mental illness, you know. So it exists that mental sickness can be familiar and can be transmitted to another person through, that is the predisposition. And we think but not complicated. And with the difference between national disease to hereditary, but not familiar. Hereditary means that no your man where the tendency that is going to pass it to this other person in a known fashion is there. And then predisposition that leads to familiar illness is that, yeah, the probability that this person will have this kind of thing is there, but it's not well defined. So, no, I agree, and Prof can also say something about that. Thank you.
Okay.
Hello. Enwe ife ndị be anyị na-eme na-abịa ịnụ nwaanyị asụsụ eje gba njọ. One of the reasons that ejeje agba njọ bụ sọ ha na-ezu ohi ma ọ sọ ha enwe history of mental illness in their family. Almost all mental illnesses go through genes. That means there's a higher likelihood that a member of the family in that generation will also have mental illness. That means they are predisposed. What they are now looking for is a precipitating factor. Like ma no nwere loss event, ma na-enwe ife mmesiri ike, a stressor, it can now break down easily. So mental illness, just like diabetes, hypertension, and then again obara, and they move from one generation to another.
Okay. Thank you, Prof. Thank you. Dr. Okpara.
So, sorry, I was raising my hand.
Okay, Dan. Okay, go ahead, so that after you, Dr. Okpara will then come on.
Okay. On we fame, I don't know so begging but emails maka stress bunke give this state of one even a state of depression. They is it from mental health or what?
Okay, Dan, thank you very much. So that mental disorder is a spectrum. It includes many, many things that we don't even see as mental disorder. And I mentioned depression. Depression is psychiatry. We from depression in English. You come up somebody now feel so depressed. No. Depression is an entity. It's a well-known kind of mental disease. And not only feel depressed 1 day, 2 days, or 3 days. As you know, we're depression. No. And then we're certain things but even to change in their mood, in their level of activity before as you know we're depression. And depression was last at least 7 days. I think it's 7 days onwards before she make that diagnosis. And then the first thing, Bononyo Bugi lose interest. Everything nana they agbavu before. Yebo no onye na like enwo me ye ma me odego guru nke kure. Yebo mo no onye na like ifwafu is not able to go out today. We call it anhedonia, loss of interest in activities that ordinarily should interest the person. The person will have sleeping disorder, insomnia, no sleep, obioku, even to get up out of the bed are there difficult. You know, and general fatigue, weakness, and where if it loses interest, the person may even feel suicidal. In fact, statistics so that about 20% of them commit suicide, but don't they depressed. I'm going to have depression. Depression can just be because of the way the brain, the neural activities of the brain, but it can also arise from somebody losing somebody who is very dear to them. Asha 500 million, maybe in Lagos. These are triggers. You know, more somebody who has been in Europe promising to marry you, only for you to discover that no when your grandchildren anymore. So it can trigger depression. These are societal factors. They're also biological factors, such as even the genetic aspect of it, that some people are more predisposed to lapse into depression. So depression is a known kind of mental disorder, and the person should be in that state for at least 7 days or 2 weeks. I think it's 2 weeks. Prof is here. 2 weeks. Yeah, 2 weeks before were depression. And onye these attributes to mention now, you have to watch the person very carefully. You know, they can benefit from orthodox medication and psychological therapy. All right, thank you.
Diko, after blessing, Diko, so I push you out the other questions forward so that after Dr. Ben, we'll just take other ones and then answer all the questions instead of answering questions from this one, and we'll lose the benefit of also getting from the other topics. So blessing, after you, we'll take Dr. Ben, please.
Okay, thank you. Good evening, sir.
Good evening.
Welcome. Go ahead.
I'm actually new here. Sorry, permit me to use more of English. I want to appreciate the organization for this wonderful educative platform. If I'm blessed to the Guna, so I would like to ask.
Blessing.
Thank you so much, sir. My question is, how about someone probably lost a loved one and he got so much touch that he or she becomes mentally unstable? How do you unwind such a person? Thank you.
Thank you, Blessing, for your insightful question. I think it has been answered in part. The person most likely lapsed into depression, right? So there are some medications, which I'm not going to begin to prescribe here, but there are known medications called antidepressants, different kinds of them.
So it's not depression. I mean, like somebody immediately lost her sense. Like this one is not depression. Like immediately the incident made the person switch.
Is it like schizophrenia?
Blessing. My sister Blessing.
Present, sir.
So, Kawala doctor to you name no by my people, you know.
Exactly. That to opara mambo nyobo. So we for unwe. Totra madero.
Boro fi ba ni ko wa e. Figo.
Okay, otana madero. No way. No funa. At the point of the incident, she just went blank. She wouldn't talk. She wouldn't respond to anything, just like that. As if she went dumb and deaf and dumb immediately.
Okay.
Yeah, it is much clearer now. There is also something we call post-traumatic stress disorder. I think that is where this one falls. Post-traumatic stress disorder, because of an experience that somebody had, you know, the person could go into this kind of a situation. Then the psychological medicine, treatment or management for such a case. I think Prof should just tell us how they manage post-traumatic stress disorder. Thank you. My diagnosis, though, correct?
Yes.
Yeah.
You are trying because that's not your field. You've done so well. If I'm no way, I'm going to talk about stress. There is no way we can avoid stress. Once you are alive and functioning, you must have stress. So when a major loss events or to expose to overwhelming stress, if I imagine the whole advice at that time is to ventilate their feelings. We allow you, we encourage you to cry. No, the person should ventilate his feelings. Oh, and now watch and somewhere. That is the initial first aid. So when you ventilate your feelings here, how to there, the person will feel relieved. But we expect that as time goes on, the rate of crying, the rate when you feel bad will also decline and it will get better functioning with time. But yeah, Bruno, after 2 weeks, after some time, the person is still feeling so bad. That's when you know that something is wrong. It may come with not able to sleep and a lot of other poor appetites, loss of interest in pleasurable activities and the rest of them. Then Yabuzi not continue, then the person may need to visit a psychiatrist. And the visit to a psychiatrist happen and we must some treatments that involve only talking, and the person will get well. So that is the best approach.
Okay. Dr. Ben, please. Other questions, please hold it. Just write it down so that you won't forget. Dr. Ben, Melua, Prof. Melua, and we then ask all the questions and answer them. Thank you so much. Oga Ben, please go ahead. Dr. Ben Okpara
no, Dr. Ben, unmute your mic. Wow, on the way network challenge since so.
And if I knows us let us email
Mazi Ben.
Okay, okay, Mazi Ben, I've seen him. Okay, I think he's not muted.
Maybe he's talking and we are not hearing him. Mazi Ben, show your video. Let's see whether you are talking and we can't hear you. Oh no, wow.
Okay, no problem. Prof,
yes, I'm here.
Prof, you mentioned that you want to talk about stress. Can you take on stress while we wait for Ben to reconnect, please?
Okay, let me see whether I can get my slides ready.
Okay.
On the project, you want slides?
Yeah, if you have slides, that's fine. We can just grant you Oga Dan, because grant you access to project your slide.
All right.
Okay.
But yeah, in slide, no problem. You can just
no problem.
Yeah.
Okay.
Maybe I will mind cover pre-ban email.
Yeah.
Okay, let me. I'm supposed to talk on stress and stress management.
Yes, sir.
Yes, sir.
Just 1 minute. Let me open the slide.
Okay.
Mazi Ben, yeah, headphone is not working. I think that's the problem we have.
Yeah. Let me chat him and tell him that we can't hear him.
You are the one that has the host this thing. If I collect it now, Dr. Chukuma, if I collect the host this thing now, all your recording will disappear. So just grant Dr. Mon the ability to project.
Okay. I'll make him a host.
Okay.
A co-host.
Are you sure I know how to really send the slide? Do I send this? Is a laptop?
If I make Oga Dan, can you make him a co-host so that
the co-host has not worked? You can just make him a host. I will claim it later.
I have a suggestion.
I can be
talking. Okay. Prof, just be looking at your computer and be talking to us. We don't need to see
Okay, better.
I'm supposed to talk about stress and stress management. You see, for somebody to be alive, it is just like your food, taking air, and all the 4 essentials of life. It is not possible to exist without stress.
Destiny, please mute Mazi Ben, please.
Are you hearing me now?
Yes.
So stress is a part of life. It is not possible to live without stress. And so the better for us, the earlier we know how to manage stress, the better for us. Some people may be asking, what is stress? Stress, I want to define it as a body's non-specific physiological and psychological response to a demand placed upon it. That's the first and the definition of stress that has been on since the time of 1956 that was defined by Selye. So Lazarus Selye defines stress as a condition or feeling experienced when a person perceives that demand exceeds the personal and social resources the individual is able to mobilize. So there is no way we can run away from stress. What we can be talking about is how to manage it. Stress is seen as a reaction people have to respond to when there is excessive pressure placed on them when coping with resources.
Sorry, Prof. Chichoko Buena, please mute your mic. Yes, thank you.
Prof, go ahead. Prof, go ahead.
Prof, you are muted though.
Just next time, just mute that person. Don't do mute for all. If you do mute for all, even the person talking will be taken.
No, I didn't do so.
No?
I'm muting each person. Yeah, go ahead.
Hello?
Yeah, go ahead, sir. Prof, go ahead.
Okay. So what are the common causes of stress? The common causes of stress. When I talk about stress, I'll be talking about stressors. I'll be talking about stress. Stressor, but the stimuli or what causes stress. So when I talk about stressor is an index of what causes the stress. So I'll be talking about stressor from time to time. And the common causes of stress, we can divide it into number one, work-related stress. And you know, most everybody that is listening to me here is working. Some of us have work that may take us 12 hours of a day, 8 hours of a day. So when you go to work, you spend more time at work than at home. So stress that is related to work. And the demanding job responsibilities, which may entail long hours, tight schedules, workplace conflicts are common stressors in professional world. Good in office, you have sometimes deadlines to meet. You have long hours to work. You also have some demanding issues that involve your work. Then another stress that we frequently encounter is financial stress. Now, this era of APC government, on financial stress. What we earn is not able to meet up with our demands, both for the immediate family and then for other extension of demands on us. Money worries. Of course, many of us go into debts, borrowing. Financial instability can create a significant amount of stress for individuals and families. That's number two source of stress. Another one will be relationship stress. Problems in personal relationships, such as conflict with family members or romantic partners, can be a major source of stress. Mgbe Dave na-efu ya so na mmadụ nwere ike ọsọ na-eji ịnụ ọ nọ na Europe, ọ nọ na America, and tells you that he will marry you, especially for our young men. And then the woman eventually gets disappointed. It becomes a very big issue, very big one for the woman. So relationship stress, even at home, between husband and wife, nwere ike ịbụ a very big one. Then another one that can cause stress is health-related stress. Either is involving you, your child, your wife, your family, anybody in your family, it can become a serious issue, especially when the sickness is serious or when the sickness is lasting long. It will have a large impact on your finances, on your time. One way or the other, health-related issues will cause a challenge and a big stressor to people. Then another one, life transition. Major life changes, like moving to a new city. Sometimes our work will involve transfers. Transfer to Lagos unexpectedly is a very big stress, a very big stressor for you and your family. Or you are going through a divorce. That can also be an emotionally taxing and can contribute to stress. Then the time when you classify as stress, apart from knowing the stressors that were, which are 5 of them, and I've just said, we can also classify stress as acute stress, episodic acute stress, or chronic stress. Hello?
Dr. Ben, we can hear you now. So just mute. Dr. Ben, we can hear you now. You will talk later. Somebody is already
you can hear me now.
Platform. Yes, we can hear you now.
Can
so you just
hear me now?
Yes, perfectly.
We can classify stress into acute, episodic, acute, or chronic. I will just talk about briefly about them, the classification, and we'll go into how we can manage stress. That's the most important aspect for us this evening. Acute stress is the most common form of stress among humans worldwide. It is usually very brief, and it's usually caused by reactive thinking. Negative thoughts predominate about situations or events that have recently occurred or upcoming situations, events, or demands in the near future. Acute stress causes signs and symptoms in the body, brain, and emotions, but they do not cause serious damage like other types of stress. What are the signs and symptoms acute stress? Number one is that the person may have transient emotional distress. For example, a little thing that should not make you angry, you become very irritable, and it may even lead you to having anxiety, worry, and then also you need to feel low in mood, which Dr. Dave has talked about depression as a symptom, not as a diagnosis. The person may also have headache. So sometimes you see an hour, paracetamol, but even go and see a doctor, the headache remains because that headache is caused by emotions arising from a stress that has not been addressed. So those kind of headache, even sometimes back pain, neck pain, jaw pain, and other muscular pains are not associated with biological issues, but emotional issues that can best be treated not by taking paracetamol, but by addressing the stressor that is causing it. The person may also have stomach problems. He may also have heartburn. He may from time to time. Sometimes they even have diarrhea or constipation. These are psychological symptoms that are manifesting as physical signs and symptoms, but they are all due to stress. Sometimes when you have elevated blood pressure, the heart may also be beating, and then the pulse may also be elevated. Feel dizzy, or as I have said, feel cold, or shortness of breath, or fast. But most importantly, they may also have sleep problems. Then episodic acute stress. In this kind of stress, the person may show signs that are also similar to what I have said: anger, irritability, anxiety, depression, short temper. If a question you will know where you were. Or very tense and impatient. His attention span will be also reduced. A student, learning new things will be compromised, or he will not be able to retain it or recall it. That may also lead to mental fatigue. Then interpersonal relationship may deteriorate. Before, but because he's having this kind of stress, the relationship at home will deteriorate. It will also worsen at workplace, and then the person will begin to have issues at work. There may also be tension, headache, back pain. These are all associated with acute episodic stress. The same thing with symptoms that are associated with the stomach. I will not continue saying them because they are just repetition. But then also chronic stress. When the stress is now the response to emotional pressure, suffer for a period of time in which an individual perceives that they have little control over. When somebody now has a stressor and the person now feels that he has little control over it and it has lasted for long, it can cause an irreversible damage to both the physical health and then also deterioration in mental health if it is left untreated, such that the person may eventually come down with feelings that he will want to kill himself or kill others. He may also have psychological issues, heart attack, stroke, suicidal thoughts, and then may eventually end up killing himself. And there, the impact of chronic stress. Our concern now is the impact of chronic stress, because these are the ones that may not reverse, like the acute stroke and acute episodic. The impact of chronic stress, one, it can cause physical health issues. Physical health issues associated with chronic stress may include high blood pressure. The person may also come down with heart disease, sometimes because of eating difficulties, either excessive eating or not eating well. He may come down with obesity, and then the immune system, our body soldiers, will be weakened, and the person will now be exposed to infections that the body would have been able to overcome. Chronic stress may also lead to mental health concerns. Chronic stress can contribute to anxiety disorders. That means it is turning from a symptom to a diagnosis. Onyoba has a psychiatric problem that can be diagnosed. Chronic stress can lead to depression. It can also impair cognitive function. That's the way the person thinks. The person will not be able to remember, he will not be able to recall, he will not be able to retain information. Chronic stress can also lead to unhealthy coping mechanisms. When dealing with something like overeating, the person may also begin to use substances in an attempt to cope with the chronic stressor. Or the person may neglect self because he's overwhelmed with stressors around him. From morning to night, and he'll carry over to the next day. And then, most importantly, there may be interpersonal relations. There may be strains in relationship. Mother Biazia, no problem at home, there may problem at work, or because he's exposed to stress. It may eventually lead to the person being irritable, or he will withdraw. Onye na-abụghị pụta na ezero, oje pia tennis, oje mee ọhụ, or no may relate with other people. He will become socially withdrawn, or he will become argumentative. If a question sana atụzụ, this era of politics, Supreme Court or Supreme Court also, the person may turn the chronic stress to becoming argumentative, and then he may eventually be overwhelmed because he's exhausting his energy in unnecessary issues. There are some of the slides that are not necessary for us. I will speak mainly grammar. So I'm going down to pick the ones that are important to us. So just down. Management of stress. How can we manage stress? That is the most important thing to us. Stress has become a contemporary issue, being an occupational hazard, and needs to be addressed without delay. There is no one-size-fits-all solution to managing stress, because it is individuals who have control over their lifestyle. You need to have control over your lifestyle, your thoughts, your emotions, and the way you deal with the problem. So the first step is to recognize that they are true sources of stress. So you need to recognize that there's a stress on you. Those stressors will need to be addressed. And it's only when you recognize that there is a stress and you are able to identify them that you can manage them. So the first one is every individual should try to modify or change the stressful situation and find some time to move away from rest, and relaxation. So the first step is to recognize the true sources of stress. People say if you don't know where the rain started beating you, you will not be able to know where the rain stops. So you must be able to identify what is causing a stress to you. What is the stressor that is impacting negatively on you? It's only when you are able to identify it that you'll be able to manage them. I want to make the following suggestions. One is meditation. Mindful practices, including meditation and deep breathing exercises, can help calm the mind and reduce the body's stress response. These techniques promote relaxation and improve overall emotional well-being. You need to expose to stress. Good madam, what is stressing you? You can meditate. Almost all of us go to church or have one religion and another. You try to ventilate the feelings and unload it to God, and then you feel relieved at the end. Then there's also what we call deep breathing exercise, and it's one of the easiest ways to manage stress. No matter where you are or what time it is, if you breathe in deeply through the nose and out through your mouth, holding each inward and outward for like 5 seconds. If you repeat it for 3 to 5 minutes, you will feel much better. This is called deep breathing exercise. Another one is regular exercise. Physical activity releases endorphins. The endorphins are like hormones, which are natural mood boosters. So if you find time, despite how busy you are, and do exercise, it will not just improve your sleep quality, but it will also reduce muscle tension and enhance overall physical health. Another way of managing stress is healthy diet. Eating a balanced diet with plenty of fruits, vegetables, and whole grains can provide the body with the nutrients it needs to manage stress. Avoid excessive caffeine and sugar, which can help also stabilize mood and energy levels. If you avoid caffeine and too much sugar, it is better for you. And then also find time to sleep. Make sure that you sleep. Lack of sleep can even worsen stress and make it more challenging to cope with daily pressures. Then another one, the number 6 on how to manage stress is time management. Effective time management can help reduce stress related to work and daily responsibility. Set your priorities right. Have a list of what you want to do for the day. Then creating to-do list and breaking them into manageable chunks can be helpful, so that at the end, you see that you follow them and be able to achieve most of what you want to do that day. And then, of course, it's also good that you seek for social support. Social support, you can come from your friends, it can come from your family members, and of course, we provide emotional support during stressful periods. Try to talk to someone you trust, who can help you, who can listen to you, and who may also understand you and maybe give you useful advice. Then prioritize the most important task. When you prioritize your work, there are those that can wait. You must not do everything in 24 hours. There are things that if you don't do today, you can do them tomorrow. So it happened you must not overwork yourself because you want to do everything today. If you end up dying, those work will still not be done. So prioritize your activities, and then know the ones that are urgent and the ones that can be moved to the next day. Then there is also need for you to seek professional help. If stress becomes overwhelming or leads to mental health issues like anxiety or depression, seeking professional help from a therapist or counselor is essential. Therapy can provide valuable coping strategies and emotional support. The era is gone when psychiatrists or counselors or therapists are seen to treat only those who are mentally sick or who are obviously going naked on the streets. We also attend to other people to help them live a healthy life. Then you must also learn, number 10, to limit stressors. Identifying and addressing the sources of stress in your life is crucial. If possible, make changes to reduce or eliminate stressors. This might involve setting boundaries at work, addressing relationship issues, or seeking financial guidance. Just like with the other day we did about financial issues, listening to people who know about it and guiding us. Then also talk about hobbies and relaxation. Engaging in hobbies or activities you enjoy can provide a much needed break from stress. Find time to visit parks, go to places, go to museums, anywhere you can go and relax with your family or friends. Whether it is reading, painting, gardening, or playing musical instruments, these activities can promote relaxation and enjoyment. As the stress is individual-oriented, each individual should develop the coping strategies and adjust his or her lifestyle and food habits that will help him cope with stress. Then how do you cope with organizational level? At organizational level, we've been talking about personal level. Some of us are involved, our chief, highly placed people at where we work, who are leaders, and even if we are not leaders, we'll still help work in an organized setting. The following are a few suggestions to reduce employee stress at organizational level. 1, create an effective and supportive relationship between employees and peers. Find time every day for detachment and relaxation with your family. You cannot be work. There must be time with your family too, so that you unwind when you are at home. Take a walk around the office to keep the body refreshed, and then reduce personal conflict on the job. Give more control over the job to employees. Learn to delegate. You cannot do everything alone. No matter how perfect you want to be, it's not possible for you to do everything alone. Allow participation of the employees across the activities and implement flexible working hours. These slides are not necessary. So I think I'm concluding. There's a vast knowledge now about various common causes of e-health arising from work or maybe made worse by work. Stress is an integral part of this entity. The good news, however, is that it can be prevented and or taken care of. Make a lifetime high investment on your health and productivity. Then finally, there is what we call the 4 A's of managing stress. The first one is accept the things you cannot change. Accept. There are situations that will come your way that you may not be able to change. So you accept those situations. Like the death of a loved one, you cannot resurrect him. So you accept. Then learn to also adapt to situations. If you work in a very difficult environment, there are people who are naturally difficult. You adapt and know how you manage them. You also learn to adopt skills and situations that will help you cope with stress. So if you use these 4 A's, accept, adapt, I can't remember the third one again, the fourth one again, but there are 4 A's that will help you cope with stress. So if you apply the A's, accept, adapt, adopt, and then the fourth one, I'll check for it, you'll be able to cope with the stress in the family, the stress at home, and the stress at work. So,
thank you, Prof. Thank you so much. Maka time anyị diko Oga Ben present ya gumeruzia anyị ajụzia ajụ diko.
Prof sodokwa ọma.
Thank you. I'll get the
coordinator. Ọkakwa mana anyị jụrụ question anyị now na resources ya o.
Hello.
So anyị de na anyị de chue so that because now man number ka wadekwara and we are running out of time too.
I'm not sure Dr. Eze is here. I've been calling his number, is switched off.
Okay, if that's the case, say Dr. Ben present anyana ajo time of anyị close anaje.
Omako indefinite time when you came from already.
So Dr. Ben, you may try now because Samara say and you get me finish.
Hello, can you hear me?
Yes, sir. Go ahead, sir. Present ya go present Rusia anya na ajuzi ajo. Ya daba nenko isa ya daba nenke prof asa.
Okay. Thank God I can you can hear me now. I've been trying to connect all this while and I'm not getting through.
So sorry for the glitch, sir. Thank God you are able to connect.
No problem. Thank you.
Yeah.
Kene madu nino kene Prof and Dr. Dave, all the presenters, Mandinjula, you and the rest. Thank you for wonderful presentation. So the topic actually from Makaya this evening about hypertension, the silent killer. Now, hypertension is a kind of
chronic non-communicable disease. A chronic non-communicable disease is a kind of and most of them but no in a manage like that. Then we're talking of hypertension, we're talking of this chronic non-communicable disease that has to do with the heart and the blood vessels. Now, within a short period of time, of course, a lot of trouble to the individual. And then with the 4 major organs in the body, very important organs that is always the target. And these organs, bro, hello, can you hear me?
Go ahead, we are hearing you.
Hello?
We are hearing you.
Okay. The 4 main organs that is always the main target of increase in blood pressure are the brain, overall, nobu, and kidney. I'm going to easy for kidney no feedback. Brain overall attention is gotten from the 2 root word, which is hyper and tension. Hyper means more than normal or too much. While tension on its own is like stress. Thank God, stress, anxiety, unrest. The state in which the cardiovascular system is not stable, is not stable because of a pressure. And in this situation, the blood pressure is consistently higher than normal. But network gives him a sort because name what to people in the battle do called retro quizzly. Yabone madu Kabaluhomba, Monemado Baroso, Monojos Lianri Ndoku, Monemado Pachule. Within that period, the ability to take care of the blood pressure, it may be very high, and that does not mean that the person is hypertensive. But the way all these things do involve in this situation. Abia check ye do carry through Queseledo, a mayor Apanambo, ye do to a case no to hypertension. So, and I don't know, Mabo, higher. These 4 main organs only may affect, but tiny blood vessels that supply blood to all those organs will either be damaged, a kind of damage either by breaking down or blockage of blood supply to those areas. And you know be made to those organs. For example, you know be made to tank over. Then stroke. About if you home with that. But if you imagine go for the somebody, only if you name a yana banabani. Agbani who knows or no Afiki bena. More only commanded food from go to these are some of the things in the maybe the high blood pressure, a metotamado novoro. Then the person will be having issues with vision, may not be able to see very clearly. Sometimes you may not see well, depending on how severe the damage done to the organ, that is the eye. Then metrota obumado. Then the person will have heart problem, hypertensive heart disease, which could be heart failure and other things. Then metrota the kidney. The kidney is a kind of a system purifier, something that clears the whole body of all the waste generated from metabolic activities in the body. So, the blood pressure, the kidney will fail to function. I will have what we call hypertensive nephropathy. And when it does happen that way, the person will have issues clearing chemical waste that is generated as a result of get accumulated in the system and cause a lot of problems. Then, Uzi kind of types of hypertension, not losing number. We can call essential hypertension which constitute about 95% of all hypertensive cases. This particular one can just happen without any associated problem. It does not happen as a result of any other condition. That is why it is called primary or hypertension. And this is what most people come down with, which is accounting for just about 5% of all hypertensive burden worldwide. Then there is actually no specific thing, the essential hypertension. The only thing that can be implicated is a genetic factor. It is likely that the chances of that individual developing essential hypertension will be higher than somebody who is coming from a family that is not having it. That is just the only thing that is more serious that we can actually look at, that is the cause. Then other things in Werike, he predispose an individual, kind of keeping somebody in a state of increasing the risk or chances of the person coming down with hypertension. Prof has mentioned some of them. Then another thing here is I have overweight. When the weight is not controlled, is a kind of placing a higher burden on the heart to function, and then it will help an individual to come down with hypertension. Another one is somebody eating too much salt. All this some of them were highly salted food, and it is something that will help an individual to come down with hypertension. Then somebody who does not eat fruits. Another thing is a sedentary lifestyle. Sedentary lifestyle, they narrow from office to office. They don't have much thing that they do that use energy. Most of the things such people do is just sitting down and giving commands. That is not a healthy lifestyle. It can predispose an individual to having hypertension. Then too much alcohol or caffeine-based drinks can actually be one of the things that can lead an individual to come down with hypertension. Then smoking, it can assist an individual. Then too much stress. Another factor, bro, age above 65. Once somebody is more than 65 years old, the chances of that person coming down with hypertension is very high. Then that one even name hypertension. It is very difficult to mention. That is the signs and symptoms, because the first sign and symptom of hypertension is no sign at all. An individual can stay and go with but somebody can have hypertension for years. Many a times before hypertension is diagnosed, it's always when the individual go for present another problem in the hospital. That is when you now discover that this person is hypertensive. And if you ask the person will tell you, I don't even know that something like this exists. Hello?
We're hearing you.
Hello?
Go on, sir. Go on, sir. We are with you, sir.
Fire on.
Okay. Okay. Like I said, the first sign and symptom of hypertension is no sign at all, and that is what the nickname silent killer. It will not show you any sign at all. Anything, already any problem. So that is the first problem on hypertension. And majority of people come down with hypertension only when it has damaged a very significant part of their system. Then
we have lost him.
Dr. Ben, we've lost your audio. Hello, Ben.
Chukuma.
Yeah.
Please, so before I connect, maybe in Dingwe question can ask their question. Throw way out.
Yes. Diko, yabuni question presentation, Prof. Joe, why we wait for Ben to connect? And when you question stress and stress management. Okay, Joe Diko.
Okay, Prof, thank you very much for your elaborate explanation about stress. I'm so concerned on how to manage it. Most of the things you do theoretical. But for those of us in Lagos, without me, men come when a rural madoro. On a cocoa, my cannon will get by you at 4 o'clock, na 11K battery. So maybe that's not take a good sleep. So my first question, how many hours makes a good sleep? Some of us go up office by 5 or 6. It may be 11 o'clock. Go back to 11 o'clock. It may be going to family now. You need to be 12. 4:30 ne panita ulozo. But me and Ezo, it's strong to give me a office before 8. That kind of life, no to use a manager. Say only host and to add. Because we become an office, even for management, work-life balance. How will you balance the life? Now go by 7 p.m. now, so you are not, you are management staff, you whatever this thing. You may know when you're on Gmail. Don't do any bending on Lagos. But Brandy business in which you do 5:30 more 6 hours. The same problem if you face. In a man that sometimes 9 vendor became we can never do know before them. I don't know is as 9 of 1 days. Though I'll do your 9 advice to manage this stress in Lagos. Thank you.
Thank you, Dada. An adult requires at least 5 to 6 hours of sleep at night. And then the beke so ora nke kuru before 12 midnight is more valuable than nke kuru after 12 midnight. So if you're able to sleep early, it gives you more refreshing than the one you sleep after 12 midnight. So what I suggest for you is that Yabuni nwere ike close n'oge ebe unu na-enwe hold up and traffic jam. Yabuni nwere ike close n'oge, close n'oge ntasi nwere ike iru ụlọ. Ma ọkwa ịchọta ụlọ closer to your office. If your house is closer to your office, it will be easier for you to get home than somebody even at one end of Lagos and working at the other end. So that is one suggestion. Then another option, if it is possible, you are not coping, you can seek for a transfer. You must not work in Lagos. That is the one other alternative. Because in as much as nobody will want you to lose your work, but there are adaptive mechanisms. Just like I say, there are 4 A's. You adapt. You adapt to the situation by making some modifications. You can look for a house closer to your office so that it will be easier for you to go. Then, closer to your office. Then you adopt a mechanism that will help you make sure that you take at least 5 to 6 hours at night. So that's my suggestion.
Mike, I'm calling the name, the one on my appear on the screen. Mike Okoroafor, please go ahead. Mike, Igwe ajo. Okay. Yeah, but Mike, Florence, okay, Diko, Joajo.
Yeah, good evening once more. Sorry, Prof. I'm going if you're not daba, not anywhere. Now, Dugama, I want to they can if anyị be ndị na anọ nche with the younger ones too. A lot of them may not complain more. To me, they complain not reality. Joblessness, ma ọ eje hada school there. Nke nweta ọrụ na ahụ m ego iji ịzụ afịa. So otu ana m na-eme mmadụ ike ọvụ dịka etu anyị nọ n'eka onwe ka anyị nwere ike inye gbasara ndị ụfọdụ na-enweta stress due to joblessness ha enwere ma ngwa ọrụ dịka for instance ifedoga certificate ekenefu maka. That's my question.
I think Prof. Each one can also Rollins. I think we follow more money on. For instance, now Ebonyi State may open scholarship. Are you getting it? I know on its Education Foundation, we post job openings, we support people with interview. We encourage people to apply. Recently, for instance, Dr. Dan was posting job openings. There are people posting opportunities in police academy. I think that's another thing, how to orient our people. You know, orientation, how they can compete. Are you getting it? How they can compete and be more personally responsible to creating success for themselves. So I don't think maybe so okay, let's contribute and go and create job for people. But people can be supported to gain employment. Yeah, but anything so they can propose it and people can see how they can be supported. So I think another one, but even more, and recently we collected database, and tomorrow we'll be sending out email to all those people who fill in the database and encourage them and persuade them. That's what we've been doing to go and apply for this scholarship, particularly in the first class, man, in 2-1. So I would imagine and I agree with you now, something that causes stress. And also, to the community interested in business, coaching them later, there will be a way to support them or fund them. That's fine. But I think what I'm trying to point out there, a support mechanism, not the back. No, it's already there, but some people are not taking advantage of it. So, Prof, because a lot of people, so that
Dr. Chukuma, you have said it all, but I just want to add that this Abuhena and Benevu certificate in Achoro, because there are very few spaces available for those certificates. We encourage people to create skills, to develop skills. That Nemadu Jere University does not stop him from having skills that he can rely on. You must not, because you read political science, be a civil servant to survive. So we encourage people to create skills and then develop their skills. And when you try one skill or another that will not do well in it, as far as he's able to go to school. So in addition to what Dr. Chukuma said, I also encourage our people to develop skills. This is the era of skills. Skills will make a way for you more than a pass certificate. And some of us that are privileged to be in positions will also let our people know when positions come up and also pursue some for them. Those that are in health, if there's anybody that is a nurse or any related health, you can always private chat me. We'll have openings that we can fix them. So that's the much I can say for now.
Dr. Ben, Yebone Dr. Ben Okpara Masu onye nwekọ question hypertension so that surgery opportunity cover cover be. Yes, so that emeluzia na anya anonya say man I like iji nyara ndị mmadụ. It's already 8 o'clock.
Dr.
Okay.
Chukuma.
Okay, Dr. Chukuma.
Yeah.
Sorry, Prof. Before you, if you pick your lip, now I appreciate if this our brother Lawrence Okereke Njoro on job opportunities. I observed that in this seminar in a main now, webinar in a main now, not but I go on the Ogrenyandi non on the duo from 40 and above. So by the grace of God, the admin will look into it and think of organizing a seminar too for our young ones, our young graduates. Gives you a certificate can apante, even an even birth certificate. Now even a second address to survive like this economy. So I think we'll look into that, and then our next seminar will be on career. Please, thank you.
Thank you so much. Very like this our platform. And the number if you like there's no way, no idea is a wrong idea. I can tell you from the point I sit now this OEF. Our young people, I don't even know what they are thinking about. I think they are more interested in maybe a politician in Adashi Hego. I know politicians give them money, but if you tell them, come, let me teach you how to get a job, or come, let me show you maybe somebody you can be following, they will take somebody that can be following. They will not even, So I think that seminar we need to take it to look at Prophecy about seeing people smoking. We complain of crime in our community. We don't know that mama don't want Igbo. Yeah, we get hallucination or feel looking and quality before you know it's crime, So I think that the way you kind of suggested community orientation, focusing
Dr. Ben, hold on. Dr. Ben, hold on. We can hear you.
Okay.
It's really good, and I support it. And I think that it's something that, of course, we'll discuss more in admin and see what we do about. So thank you, Okereke, for that thought, because your question has provoked an opening for our next project on this forum. So, Dr. Ben, hypertension, so that Dr. Ben can pick it up and probably incorporate what he has not said because of our time.
Diko, I want to say something before Dr. Ben continues.
Yeah.
Do I have the floor?
Yes, please go ahead.
Amanum, how many of us know that this platform? Recently, our elder, Professor Ogbu, was chronologizing the names of Ndi Onchanguhoro because they were not treating their hypertension well. So if I want Dr. Ben Nepu, we boil down to the fact that many of us, even in this platform, don't know our blood pressure. Yeah, but only check your blood pressure in the last 1 week, in the last 1 month, and you are above 40 years. I want to encourage you. Okay, the summary of it is that hypertension is a silent killer, and it is very, very common. And where free medical treatment in Jeremane, one of the communities, almost 80% of the people that we checked were hypertensive and they didn't know. So hypertension does not show. You don't even have a slight headache. Nothing shows that you are hypertensive unless you check your BP. So I want to encourage us. Dr. Ben will talk about it. But if we listen to all the grammar, the summary of it is that all of us should know our BP. Many of us are hypertensive, even in this platform, but we don't check it. We don't know it. And if you don't take your drugs, if you are hypertensive, the final result may be stroke. And the person may even be lucky to have stroke. The person may just die suddenly. So the best lecture on BP, on hypertension, is that everybody should be checking his BP often and on. And if the person is hypertensive, he must be taking his drugs religiously. I think that is the summary of his lecture. I'm not preempting him, but that I want to encourage us. I have lost very dear ones, very dear friends in Onicha Igboeze because they were not meticulous with taking their drugs. So let us know this, that as we are growing old, whether it is in our family or not, that hypertension is a silent killer. Let it not kill any of us because of not being careful with checking our BP and taking our drugs. Thank you, my brothers.
Okay.
Sorry, I've been raising up my hand for a while now, but it's like
Ogachigozé, go ahead.
My
Ogachigozé, go
hand is
ahead.
up.
Thank you. Good evening, everybody.
Good evening.
Thank you for that contribution.
Thank you. So, on a very good day, what I want to say is not what people have not said. It's regarding the brother that asked a question of the people that have certificates, but so what they did in Heka. So, as I remember, but no with some example in just like two. Today, my wife went from Lagos to Igboeze, so to say, Backup University. He supply amount of oil. That person was a PhD holder teaching in Babcock University. She resigned to be a cook to sell to students in the university. And according to her, she's making more money than what she was making being a lecturer. Now, where I'm going is for the brother Angelo. Yes, that's the question very well, that you must not wait for paid job. I also have example of one person from our Umwezuvu, graduate. Here just serve on a Lagos Island. Now he's a millionaire. So if you have such opportunity, he serve after being a graduate, it does not remove anything from you. It will make you to understand the business even faster and better than Onyenjire with little knowledge. So where I'm going is, you have the certificate, good and fine. You can learn a job. You can learn anything and use it to feed yourself. You can serve. It's not bad, and you are not above it. So if your hand could find anything, just where you will just find out that, in fact, it's not. Do I say that? I'm not trying to say that being a salary earner or doing a paid job is not good, but then where you cannot get that, then you can do any other thing your hands finds. And myself here talking also, a graduate, I'm doing business. After my graduation, I just attached with business. After 5 years, with the little I gathered, I said, my brother, please, I want to go and start business.
Dr.
So you must
Chukuma,
not be given a job. Thank you.
Okay. Yeah, thank you so much, Chigozie. It boils down to that orientation. Our people, we need to do more to orient them. And thank God, Dan, no better, give me a program focusing on youth. So we'll plan it, and really, people like you, we can bring you to come and speak, to them. So,
Blessing. Question for stress.
Okay, go ahead.
Go
ahead.
Doc, you talked about hypertension, and before you, someone talked about stress. And based on most of our elder sisters, my leg, my head, my hand, low BP, high BP, and all that. So now, what's the relationship between this hypertension and the stress? And also, I would like you to give us some tips about low BP and high BP and their effect and management. Thank you.
Okay, Dr. Ben, please, you answer this question. We've answered question time. So from this question, you'll be able to...
Thank you for that question. So stress is one of the things in the from every a kind of definition of hypertension. Tension is like a stress, unsettled situation the entire system is not stable because of the pressure. Now, these daily activities, like in web prof na stress, and also with part of stress, type of stress syndrome that will help you to cope, that will help you to a kind of brace up to meet up your daily needs, daily demands. Then there are just only when it becomes too high that is because but it will be detrimental to the health. Now, when it is too high, that is when it can lead to hypertension. Or higher than normal. And the relationship between that and like nke onye ebe na mmadụ nọgidere aka na-akpọnwụhụ ma ọkpa na-akpọnwụhụ ma ọkwanụ onye ehima na-ahụ ụzọ nke ọhụmaghị ma ọ mmadụ anaba nke ọgbanihu. Some people mgbe ụfọdụ ewuru na-akọrọ ọvụ ya nwụ ma nọ ndị ma tibere or things like that. Some of them are not like that. Some people na-aṅụgị because of this. A very, very close relation of mine was one of the people that suffered this. That I have to be talking about this thing everywhere I go because I'm involved, no metotram. So, the stress I do too much now, measure the blood pressure I do high, and nke gị mmadụ ọkpọnwụ like ya bụrụ n'ime aka ụkpọrọ ma n'ime ụkpọrọ no center. The brain is what controls every activity of the body. Now ya bụrụ na before those things are na-arụ ọrụ, there must be blood supply. It is the blood that supply to the cells, that supply the nutrients, that supply the oxygen, that supply everything. Those cells ji na-arụ ọrụ. The hypertension na-abịa cut bịa mee nke ọdụghị ike na supply either na blọkụrụ ma ọkwanụ net the pipe na supply iji ọbara bịara bịa gbawara ruptured, then such kind of issue of maybe all the areas that are cut off, the activities being controlled by those areas will now cease to function. Ya bụrụ na side na control aka nri bụ nke o metụtara. Then you also mentioned something like low BP. Sometimes low BP will keep as a result of use ovu. Or lower than normal. Then sometimes so the LCM of the whole team say onye ọbụla gbachapụ anya onye ọbụla mara ife mbụ the normal blood pressure ihe ordinary oke ọnụ like in a place ka anyị nọ na gị check your BP. Ya bụrụ na ahụmazi ya n'ọdụ high, then will guide you on what to do. Abamsenzara ajụjụ.
Thank you, Dr. Ben. That's very nice. Dr. Chukuma, we won't take much of our time. Diko, can you give these people number? Yabuna Juro, answer your question. Bring down your hand. Nauma, Chief Chijoke, and the Mike, and the Steven. So, argue somebody in type on a question the chat. Let me say it. Prof, this is to you. Concerning stress, somebody who does not have enough time to rest because of work, can the person use one day to cover up for the days of stress, like Saturday and Sunday, and sleep, and sleep, and sleep, so that you will cover up for the lost days of sleep?
No, the body does not work that way. The body does not work that way. Chineke nkere mmadụ kere nye night to sleep and day to work. So the body cycle goes that way. And that is why go travel from one zone to another. You get disorganized from what they call jet lag. So, and when I carry over trouble, so suffer. Maybe after 1 week, you sleep the whole day to catch up with the other ones. No, it doesn't work that way. Your body needs to sleep, to rest, to eat, and the cycle goes that way. So you must find a balance. Because good okay until after 1 month. In the easier week for another 1 week. You break down and die even before that 1 week. Before that 1 week will come. So we must find a balance.
Okay, thank you very much for that.
Then ịchụ aka n'azụ ya bụrụ na ijere ife na otu nke iri nri otu ga-ede ozi tu mgbe ga-ewe ya eke na ezere abalị ike na mmisi na ga-ịpata nri otu na nke efu erikọta ọnụ rie tie na nke abalị ntasị otu etu.
Okay. Chief Igwe, with your question, please.
My question for Prof. Imangbe onopu maka ikura. Osne orekru before 12 midnight. Bunke nkama. So na jue onye ọrụ ebukwa no a security man. Ewu no we so kura no duku. Because no duku nke ononde chenche. So okura ni no jineku na efeba. Ewu no do ma. So Jamai walk like that. Thank you.
If you don't know, so you have onye na-arụ security n'abalị. The system moto ji work. So kuzi ụra na-efe. But ya try ya ku at least up to 6 hours na-efe. So chọta ka oge nọ na enwesị disruptions more noise. So nwee ike ikuzi ụra ekuzi. So that uduku o nwee ike ịrụ ọrụ ya. Onwena ife o mere na ya ku a na-efe. The important thing bụ na okuru ụra at least within 24 hours time.
Okay, thank you. Stephen Obona, please, your question.
Stephen, go ahead. Hello, Stephen.
Blessing.
Blessing, a question.
No. Sorry, good evening, everyone.
Okay, yeah, go ahead, Stephen.
Thank you.
Okay, so I want to first of all, you can organize this program, right from my elders to the Prof to my brother Ambude. So I'm Stephen Obona from Okpoma. So I come my question today was directly to Prof concerning the chronic stress image reference on. So imagine about lost memories, people when we can recall things that happen. So how can somebody under that category, is there the treatment when you need the person? Thank you,
sir. Good try. I use this approach in here. Approach in here, then with 4 A's. I have been able to record the 4th A. You may apply the 4 A's. You'll be able to attend to almost all the stressors. Nke mbụ bụ ya bụ na ọ dị possible avoid unnecessary stress. Like mgbe na-eme politics, go begin na argue na Labour Party mere ọhụ, Labour Party eme ọhụ, PDP mee ọhụ, APC mee ọhụ, unu a na-atụ ụzọ na-eme mbụ your BP na-arise. Avoid such situations. Then another one bụ alter the situation. Ya bụ na ife ị nwere ike imenwu alter. Okay, n'ibu na candle noisy. Every night, gwongworo na ya na-agba opu. And n'oge ekwego kuzi ụra. You go and look for another accommodation. Alter the situation as much as possible. Then another one bụ ya bụkwa na ọ bụ ife ị nwere ike ime, you adapt. Ya bụrụ na ya dị eke na ụzụ na-atụ. You cannot change the place immediately. You see whether there is any way you can adapt to the situation. Inabata otu ọbụla na manage until when the condition can change for you to change. Then you do that. Then the last one, accept the things you cannot change. Ya bụrụ na enwe ife mere, if and you know you cannot change the situation. So if you apply these 4 A's, you'll be able to address chronic stress that will come your way. Stress in one way or the other. But if you apply these 4, you're not avoiding it as possible. You see whether you can alter the situation. If you are not able to alter it, you adapt or you accept it the way it is. It is not really, we are mortals. The power of God, He change every situation that comes. So with these 4 A's, most people are able to cope with the stress that comes around them.
Thank you, Prof. Thank you so much.
Yes,
Blessing.
thank you, sir. So much, sir.
Blessing, your question, please.
Okay, thank you, sir. Thank you, James. So please, let me apologize ahead. My question might sign off, especially for the past man. Or the government, I know for one on the car. So
so that better get gender balance. Go ahead.
Okay. So my first question.
We can't hear you. We cannot hear you.
Maybe network. Let another person ask now.
Okay.
I can quickly make a very small contribution.
Okay, yeah, make contributions and Mike Igwe, because we want to close.
Miracle John, off your mic, Miracle John.
Mike Okpara Igwe. Okay. Diko, Dr. Dave, go ahead with your contribution. After that, I think
Hello.
Yeah, go ahead.
Can you hear me now?
Yes.
Okay. Oh, Mike Okpara.
Okay, go ahead.
A situation where maybe this thing has happened to me.
Mute your mic. Mute your mic.
A situation when 2016, I lost a very close friend. The thing made me affect so much that psychologically, it made me affect. To the extent that at a point, I was trying to forget about him, but go away from Nuki. I couldn't sleep because of it. It took days and the grace of God for me to recover from it. So that situation, if it were not up, or stress or mental problem or whatever. So it was really a hell for me, and I really want to know how can one avoid such a situation?
Yeah, anybody can pick it. God Dave or Professor Igwe, you can.
Ben, anyone can pick it.
I think post-traumatic this thing, Dave, so you can pick it, or Professor Igwe, you can.
Okay.
Mike, let me just put in a word. The way you felt, the way you felt is normal. There is nobody that loses a very precious item, not to talk of even a friend and a close friend for that matter, that should not feel it. So, but as time goes on, you are supposed to adjust to that loss and get well. So it is what is expected. It is when it remains permanent, that your feeling of badness and whatever you call it, if it has been sustained, that's when you say it is abnormal. But
it was sustained for over a week or more, even when I was trying to forget it.
If it was sustained for more than 6 months, that's when we get worried. And that is why when you lose a dear one, we expect that your period of bereavement, you may start by denying, oh, it cannot be me. This person cannot die. And with time, you begin to accept the situation. And then, or you begin to bargain. Oh, it could not have been this person. It should have been another person. Then you go into a state of depression. And then later, you now come to accept, oh, this is the reality. So within 6 months, it is accepted as normal. And that is why most times people will begin to feel bad during the anniversary after 1 year. When they now recollect, oh, after 1 year, this thing during the anniversary, this thing is bad. So what you pass through is a normal bereavement process, and you were able to navigate it properly. So nothing is wrong with you. You went through a normal bereavement process. And so it can happen to any of us. It shows that that person was actually dear to you. So if it is just 1 month, 1 week, less than 6 months, there's nothing to worry about. You went through it normally, and that means you are well adjusted as an individual. So there's nothing to worry about it.
Thank you. Sorry, I want to add that this each of these topics discussed today is something that cannot be exhaustively discussed within this space of time given here. So in order to avoid I think I want to suggest some the contact should be on the platform. So anyone that you still want to ask personally that has not been attended to here, you can reach any of the presenters for further discussion. That is a suggestion. Thank you.
Thank you, Dr. Ben, for tipping that in.
We are coming to that. That's a good one.
Yeah, thank you. Diko, I think like he said, in fact, if a matter of PhD, if may expect may exhaust within these 2 hours. But I can say categorically that they've really done justice and given us something we can start with, you know. So I think it was 2 hours worth well spent. And with this, I want you to Chief Igwe Sonye vote of thanks. After that, Oga Daniel they close
Oh, sir, can I continue?
Okay, blessing. Okay, go try Joaju Chief. Say blessing Joaju. Has as here in Yesia vote of thanks.
Sir?
Go ahead, blessing. Blessing, Mike, you to go to go. Okay. Blessing, Diko, every other a contact the person 3 aspect.
Can you hear me, sir?
Okay, go ahead.
Can you hear me?
Yes, go ahead. Go ahead. Ask the question.
Okay, I think please, Dr. Chukuma, mute her and
Chief Ikwagu, please go ahead with vote of thanks. Thank you.
How about now?
Mutua, so that I'm making a vote of thanks because my name is Dr. Okoroafor Bidonambo, and we both through the Kamakautu ING with this opportunity. We mentioned psychological effect. Yes, our meeting today has a more psychological effect on all of us. So even like Adam Onibanye, and then they will have politicians.
Engineer, sorry, unmute yourself. Chief Ikwagu, please unmute yourself. Sorry.
Oh, sorry. Dr. Okoroafor. We both lost meeting here that no way psychological effect on all of us. And not lazy. Because therefore you the Kota where not on time. But now can I come So how many politicians out of this number participated today? We're going to know how many of us, but politicians, and they will not be able stakeholders of any Onicha. Because those politicians, they feel concerned about Onicha because even there, these facilitators, no, even we today. So I expect that many business, many more politicians, they depend with because you can't give what you don't have. But what you have to give it to the Onicha. So I expect much from politicians. And then they make people to but I think we have an assignment. Go to various parts of the country and the world. Next meeting, when end on Tajinwe. So I need to in on this platform today. That any make even to participate here because that's the only way for us to move forward. They can airport here because this kind of generation Bundi Mara no Bajime Onicha, I do better tomorrow. All the time, effort, my treasure, and what all that is making mention. All the sacrifices you make it's not in vain. You know why you appreciate. Believer with all these efforts that nature Yeka Makarianta, Onicha Igboeze. So remember me, my Danny, my that's Dadan, my Dr. Chuma, and they organize this thing. All the lectures, Chineke Jegozi, Madnine, Anionka, Genonira, Anine, Lepa Jesus Christ.
Amen.
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 God bless you.
Yeah.
Okay.
Elder Dan, I hand over to you, sir.
Yes, before we open the mic for greetings and other things, hope got everything our Oga Chief Igwe. So I encourage say utilize this opportunity for ourselves, for our health. Yabunema de nweta efe maka njọ ye ebe no mi fenji mi so no togonogo njọ. Obije kpata ego nke oji nweta efe je. I'm not trying to repeat what he has said, but if I be paying the expect now out of 530 something on the platform, and you at least minimum of 200 you may attend. But the maximum we had at the time was 35. And then all the very poor. Well, thank you, everybody may attend from the resolution. And you will have no any question in way. Because this thing may happen as a bear. You will send them or send the Dr. Chukuma. And you forward to the very facilitator in Kobo so that he will be able to respond to you. Thank you very much. I think we did well. The floor is open for pleasantries. God bless you all.
Diko,
thank you, everybody.
Diko, Diko na-ejekwa ịbịa nyere m aka mkpọkọ ese nwee ihe njikwa ime invite na our own platform diko n'ọkwa ibe anyị eke gịrị m igiri na agba nka ha nọ nte